Kids are unique. Kids are resilient. When they are sick and you treat them, they usually bounce back, often to the point where they don't even remember that they were seriously ill. I think if you're looking for a place where you can not only just learn about disease processes and new diagnostic therapies and new tests, but really to establish that relationship of, I'm going to be there for that child for whatever they encounter. If you like that responsibility of being an advocate for your patient and their family, then this is the place to be.
There hasn't been a time that I haven't been glad that I went into pediatric pulmonology or chose to stay at Rainbow. I think the opportunities both at Rainbow and pediatric pulmonology are great.
We are a tertiary care children's hospital, and in some cases a quaternary care children's hospital. So we take care of patients who have very unique and rare diseases. But in addition to that, we serve our community. And Cleveland is a community with a lot of health disparities, patients with a lot of challenges in accessing care. So the spectrum is really very broad.
We're in a position to inform society, inform families, inform children. That's a significant impact we have, and it's really nice that you have that relationship with the family, with the parents, and then that the patients appreciate that as well.
The Rainbow Training Program has been in existence for longer than most programs. It's been over 50 years. It's trained now close to 70 pediatric pulmonologists, and many of the leaders within pediatric pulmonology of other hospitals did their fellowship training here. It's not just who the fellows are working with, it's all the people that who they're working with here are working with.
The leadership wants you to become the best pediatric pulmonologist that you want to be. And so it's really up to you, whatever you're passionate about. The program supports that in any and every way. How the program sets you up for leadership is by really giving the fellows autonomy. So if you have a patient that you follow with an attending, you as a fellow are the primary.
I think that it's been really valuable, the relationship between fellows. If we ever need help with something, we're both willing to see patients for each other, or if we know about a learning opportunity, we'll bring it to the other person's attention. We can give emotional support when things are really challenging.
One of the other great things about this institution is the commitment to training really across the spectrum. So a big part of training fellows is training them to be educators at multiple levels. They're really encouraged to take an active role in teaching the residents, the medical students, and then a big part of pediatrics is teaching families and kids to learn how to take care of the conditions that we see them with.
They have an excellent bronchoscopy training program here. I've had very, very patient teachers helping me learn how to do bronchoscopy. And overall, I think this program is really good at getting the bronchoscopy numbers necessary to become proficient in bronchoscopy.
Options or the opportunities for any type of research is open to fellows here. If your passion is clinical research, then that'll be supported here. If your passion is basic science, that'll be supported here. If you have a different passion that we don't know about, population health or whatever, that's possible. And you're encouraged to pursue the question that gets you curious.
The work you do is only the work that is necessary for you to do to get good training. And it's work that you want to do and that you're passionate about to take you on the path that you want to be on for your career.
If you're curious, you want to explore and discover, and you're willing to put in the effort to learn new skills, then this is a place that those people would thrive in.